Hi, I'm Chief Jed McLaughlin from the Ridgecrest Police Department. Today I'm here with Jim Suver and Brenda Deal from the Ridgecrest Regional Hospital. We understand there are many in our community who have concerns about the coronavirus. We are here today to provide you information about the changes we have had to make in our agencies to mitigate the impact within our departments and within the community so that we can continue to provide quality service and public safety. Should the situation arise that several officers are unable to perform their duties, mutual aid agreements with other agencies within the county are in place that other officers would respond to our area and take over duties for the Ridgecrest Police Department and provide quality service in the absence of those officers. The community can help us when they do call and an officer has to respond to their location. If they could let the dispatcher know if they are having symptoms of the coronavirus so that we can respond accordingly with our personal protective equipment, that would help us greatly.
I'm Jim Suver, the CEO of Ridgecrest Regional Hospital. Working with the Ridgecrest Police Department and the Kern County Public Health Department and all of my wonderful team at the hospital, I want to assure the community that our local hospital will be able to take care of any patients during the coronavirus scare that is going on at present. We practice on an ongoing basis our emergency plans for such a type of event, and that includes ensuring we have enough supplies, that we have surge capacity so that we can take care of more patients by opening up alternative locations and utilizing some of our outpatient hospital beds. I am certain that if the community works with us by communicating with us prior to coming to any hospital services, we can protect both patients, our staff, and the community from further spread of the coronavirus. I know that there's been a lot of questions and concerns in our community about whether Ridgecrest Regional Hospital can collect the samples to perform the coronavirus test. I want to assure you that we have been always able to collect lab samples. What has changed, though, as of yesterday, is we are now allowed to use our own reference labs, our outside labs, to perform the test, and this will result in faster test responses. And also it's important to realize that as of yesterday, we no longer need to get Kern County's permission about whether or not we run the test. Our local physicians, using CDC protocols, can make that determination right here. If indeed we have an influx of patients due to the coronavirus, or for that matter, any other major public health emergency, the hospital would first cancel any elective procedures and exams. That would be things like non-emergent diagnostic radiology, non-emergent outpatient surgeries, so that we can focus all of our efforts on taking care of our hospital inpatients, our emergency room patients, as well as our residents in our skilled nursing facilities. So in the event that we are operating with increased patient load, we will have some alternative delivery sites that have been included in our plan, and we will likely consolidate our outpatient clinics into one location so that we can better centralize all of our physician and other clinical staff resources to make sure that we're providing efficient and effective care. As part of our alternative destination planning, and assuming that our patients do notify us in advance when they are coming in with symptoms that may indicate coronavirus, we may very well ask you to wait in your car, and we will send out staff, including a medical professional, to do the examination in your car. This actually will protect other people that are waiting in the clinic, as well as hospital staff. We would appreciate your compliance with this as we strive to protect our community and our hospital staff to make sure that they are well enough to take care of our community. Thank you so much for your understanding on this point. The coronavirus is an ever-evolving public health incident that requires constant changes to our plans. We are continuing to work with various government entities as well as our local police department and city management to ensure we're doing the right things for the people of the city of Ridgecrest and surrounding areas. Again, I want to assure the community that we have planned for such a type of event and that we have the necessary supplies, staff, and capacity to handle the coronavirus during these trying times.
Hi, I'm Brenda Dill. I'm a registered nurse and the administrator for Quality, Infection Prevention, Safety, and Risk at Ridgecrest Regional Hospital. I think it's very important for the community to follow the recommended preventative advice from the CDC regarding staying home when you're sick, avoiding people who are sick, ensuring that you're washing your hands frequently, either with soap and water for 20 seconds, and if soap and water aren't available, using hand sanitizer that has at least 60% alcohol. I think it's very important also that we avoid touching our eyes, our nose, and our mouth, and when we have to sneeze or cough, that we use a tissue and throw that tissue away into the trash as soon as possible. If you're having any symptoms or have traveled to one of the affected areas, that you call your health care provider first and let them know that you have some symptoms, and they will direct you on what to do. It's important for you not just to walk into the clinic, because we want to minimize the exposure to other community members. And then if you are positive for the coronavirus, it's important to follow the instructions that your healthcare workers give you to decrease the exposure and to help speed up your recovery.
I know that the Ridgecrest Police Department and the Ridgecrest Regional Hospital's #1 priority is the safety of the community. And I've seen this community at its best just a short time ago. So please have patience, work together, communicate with us during these changes, and we will get through this together like we've already proven we can do it anytime. Thanks.